Thank you everyone for being here today. I want to introduce Judy Sheridan-Gonzalez, emergency room nurse and president of the New York State Nurses Association.
Thank you for attending our protest today and our press conference. We are in the middle of the most challenging situation we've ever confronted as a nation and as a society. It's an international crisis, as we know. It's a pandemic. We are the warriors in the front lines fighting this pandemic. When you are at war, you know who your enemy is. You know who they look like. We don't know what this looks like. It's a microscopic enemy. And we do not have the arms and we do not have the armor to protect ourselves or to protect the public from this enemy. During World War II, the president invoked a production act that transformed all of the factories into weapons and armor factories so that our soldiers, when they went to war, when they went overseas, when they went to Germany to fight the Nazis, they had weapons. They had armor. We don't have the weapons. We don't have the armor. When we talk about PPE, the measly PPE that we get, some of which you see people wearing, is not what they had in China to save lives. The first wave in China, people died. Healthcare workers, healthy, young healthcare workers died because they didn't have the PPE. The second wave imported 40,000 healthcare workers to Wuhan. They had the PPE, they had the support, and they were able to save lives, and there was zero transmission. We are dying. We are getting sick. It doesn't matter how many ventilators we get if we are dead and cannot run the ventilators. If respiratory therapists, if doctors, if nurses, if frontline caregivers are sick, are dying, there won't be anyone left to take care of the public. We are demanding to invoke the Defense Production Act so that all of our factories can be spinning out PPE for us, ventilators for us, materials that we need to save people from this pandemic that will only get worse. We are demanding that we get all the hoarded supplies that exist of PPE so that we can protect ourselves, our families, and our beloved patients and communities. We can't do it if we're dead. We have already lost frontline caregivers and many are ill. Many of us are positive, are COVID positive. We need the support of the public to help us protect the public. You're going to hear from some frontline caregivers who are going to tell you their stories and their concerns during this press conference. Again, thank you for being here. Help us help you. The CDC has abandoned us. The government has abandoned us. Our hospitals have abandoned us. We know that our public will not abandon us. I would like to present Xenia Green, pediatric ICU nurse and a member of the NISNA Executive Committee here at Montefiore. Please welcome Xenia Green.
Hi, thank you all for coming. Thanks for showing up here in support of us. As Judy said, my name is Xenia. I am a nurse, pediatric nurse, and prior to being a pediatric nurse, I was a 911 New York City paramedic. As nurses, we don't want to be sidelined. While our communities are suffering and we are getting sidelined because of COVID, and it is unnecessary. We need personal protective equipment. Wearing personal protective equipment doesn't only protect the nurse, though I would like you to take that into consideration. But if I get sick, who's going to take care of you?
We are afraid and we are so upset and angry what is going on inside this hospital. We do not have right PPEs to take care of our patients. So we are transmitting the disease to our family members, the patients who are negative for COVID-19, and we are spreading this disease to the community from this right hospital. And the administrators are not willing to help us, not willing to work with us, and it is outrageous. A few days ago, I was tested positive for COVID-19, and I'm ready to back work now. They don't care. If you can move your hands, if you can walk, if you can talk, come back and work for it and make people sicker. It is outrageous, and we need to stand against these outrageous actions from hospital administrators our politicians, and all the healthcare agencies.
I work here. My unit has been converted into a COVID positive unit. That means all patients we take care of are COVID positive. If the ICU does get overflowed, we will get ICU patients. Whether we're trained or not, we will be forced to get ICU patients. Personal protective equipment, aka PPE, is a responsibility of the facility. They must provide proper and adequate amount. Here at Montefiore, management is requesting we bring in bleach spray, our own wipes, because they cannot provide it. This is a disgrace. Requesting workers to reuse PPE is never recommended after being in contact with a contaminated environment. However, management is putting in writing that we are to reuse our masks, gowns, and face shields. Reusing contaminated items put me at risk. It puts you at risk. It put everyone in the healthcare building at risk. If we are accepting patients without the right equipment and right staffing, it is a recipe for patients to die and healthcare workers to get sick due to exposure. Montefiore and this government need to get it together. This hospital is behind rollbacks on CDC and DOH guidelines. And meanwhile, frontline workers are getting sick by the dozen after days in and out of working without proper PPEs. We call on management, healthcare agencies, and the government to increase production and to access us PPEs. We must do better than this. Shame on you. If we are not safe, nobody's safe in this community. So please help us. We need your help because one person gets sick, they go outside, they give it to somebody else, and they give it to somebody else, and we're all getting it from the same place. We're supposed to protect patients and the community.
Hi, my name is Laura. I'm a third-year resident physician here at Montefiore, where we're running out of PPE, we're running out of pain medicine, we're running out of sedatives, we're running out of oxygen masks. I was given one disposable yellow gown to reuse all day taking care of COVID patients, and I would hang it up on an IV pole in between patients and put my single N95 mask into a brown paper bag. Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament. I'm 28 years old. We fear that we may not survive this pandemic, and yet we show up every day to this hospital to take care of our community. People have been saying that coronavirus is a conspiracy, but the virus is not a conspiracy. The situation we are in now in many ways is. For years, government structures, corporate hospitals, private insurance, and drug companies have conspired to leave the most vulnerable without adequate resources. This is a man-made problem, and we need a man-made solution. We are told that they are searching for more PPE. Today, I stand with the nurses to call upon Donald Trump, upon our local and our hospital leadership to stop looking for PPE that doesn't exist and start producing it. We are past the point of last resort. Thank you.
Can you spell your name?
Laura. My last name is U-C-I-K. Thank you.
Montefiore is making our situation even worse. They are trying to close Mount Vernon Hospital. How could we close Mount Vernon Hospital in a time of crisis? That hospital has 121 beds that we can use to take care of everyone.
Get those factories running. Produce the materials. Make sure that we get them so that we can survive, because your survival depends upon our survival. We are spending most of our time learning how to double shroud corpses. We want to spend our time learning how to calculate IV drips, regulate a ventilator, and bring someone back from near death. That's what we're supposed to do. That's what we want to do. And we can't do it without your support. But maybe we thought you don't know what's going on. We're here as testifiers in this war to let you know that we can win this war. But we can't do it without you, and you can't do it without us. This is a partnership, and we know we can win. We need more than prayers. But right now, we're going to hear a prayer, because that's all we got right now.